So one of the questions that people should be asking you, and really they should be doing, is why is flossing important? Do I really need to floss my teeth every time?
Isn't flossing one of those chores that people hate to do for some reason? I mean, there's people that love to floss, and there's people that say they floss twice a year when they come in for the dentist office.
I'm not someone that loves to floss.
So
tell me why I need to do that.
Well, the toothbrushing can only get so much off. The little nylon bristles cannot get in between your teeth. And so if you think about the most warmest, moistest place for a bacterial culture could be, in between your gums. And the only way you can get that off is with flossing. Now, it's not true about the only way, but it's the most effective way. There's other ways you can do it with tooth picking, with little brushes, but when it comes down to it, flossing is the best way to do it. And so a lot of people think, well, I've just used Listerine. Well, you've got to mechanically remove that sticky plaque, which is thousands and millions of bacteria that are just hanging out having a party there, and they need to be gone so that you can prevent periodontal disease.
Okay, great. Now, what about I know that when I floss my teeth, sometimes it bleeds a little bit. Does that ever go away, or is it because there's so much stuff in there? What causes the bleeding?
Well, bleeding gums is the first sign of infection, and so you can call it gingivitis. And if it's gingivitis, as long as you don't have any bone loss. But if gingivitis is left there and persists in your mouth, it will translate into periodontal disease, which is gum and bone loss or disease. And so bleeding gum is a sign of an infection. Sometimes if you have a little, get something packed in your gums and you get it and you floss it out, that'll bleed because it's irritated, and that goes away within a day or two, no problem. But if you have persistent bleeding gums, you definitely need some help. And after you get professional cleaning, regular routine flossing, the bleeding should go away completely. If it's not, then we need to be taking a different approach with your mouth as far as probably more flossing or even sometimes more cleanings. Because it's just, like I said, the bleeding is the first sign of infection.
Okay, great.
Thanks for viewing my video. I hope you found it helpful. For more videos on what you should be asking your dentist, please go to the website below.